Good morning. I'm Lucy Beadnell with the ARC of Northern Virginia, and I'm really excited to be with all of you all today to talk about Virginia's Medicaid waiver programs. Just before we get started, I wanted to remind folks that if you're watching this recorded later on our YouTube channel, you can always go to thearcofnova.org. And if you click help in the upper right-hand corner, any questions go to me. So if you have questions about what we shared today, you need a copy of the slides, if you lost it or didn't attend live, absolutely feel free to reach out there, and we're always happy to help. The other note I wanted to give as we get going today is that a lot of questions have come in recently about some changes to Medicaid at the federal level that are expected to start taking effect this year and in the coming years. And I wanted to clarify that as far as we know, at the present time, none of those changes directly impact the Medicaid waiver program. Of course, those changes are cuts to Medicaid's overall budget. I don't delude myself to think there will be no impact. I think that there could be harm, but no one knows what that would look like yet. And we won't know for a while until states decide how they're going to implement a lot of these federal changes, and those changes roll out in the coming years. So everything that I'm saying will be true to the best of our knowledge as of August 2025. Again, feel free to ask questions, but that's as best as I can give an answer to how the current federal landscape may impact what we're talking about today. So we'll go ahead and dive in here, talking about the waiver system. Backing up quickly, if you're not super familiar with the ARC of Northern Virginia, a lot of what we do is advocacy, and that's advocacy to change budgets, laws, rules, and regulations, working mostly at the state and local level. We have a state chapter and a national chapter and others that work on other levels of government too. We do a lot of education like this webinar. So when I send the link to the recording out, or if you're watching this later, please feel free to peruse our YouTube channel. There are hundreds of videos, 3 minutes long, walking people through what's a waiver or what's the waiver waiting list or those kinds of things, all the way through much longer sessions. They're great ones to share with friends or family, or for you to explore on your own. We do lots of free information and referral. Feel free to ask us anything, anytime. We know a lot about disability services in Virginia, but if we don't know, we'll do our best to get you to someone who can help. We are case managers for some folks who have the waivers that we'll talk about today, so we work very intimately on these issues. We run a public guardianship of last resort program for people who need a guardian but really don't have anyone else to serve in that role. We run a special needs trust as a way to help people with disabilities save and inherit money in a way that enables them to have some financial protections and maintain eligibility for public programs. And because that intersections a bit with a trust, I'll talk about that briefly later. And we have a very cool program called Tech for Independent Living. They can create free and completely customized apps like that you would use on a phone or a tablet for someone with a developmental disability to help them learn or master or reinforce skills. Things like how to learn to make a specific meal, how to use the copier at work, how to get from your home to your workplace on Metro. I mean, you name it, sky's the limit. So just know that's all there as an option for you. Today, we're going to dive into what Medicaid waivers are, and then how you know if someone's eligible. We'll talk about the services that the waiver offers. And then we'll go on down to how you apply. So once we sort of have in our head, is this the right program for me and which of these waivers is a good fit? We'll talk about the application. And one of the waivers we'll talk about today has a waiting list, and we'll talk through that in some depth. So first, starting with the purpose and description of waivers. I'm saying waiver a lot. Some people say Medicaid waiver. That's true, absolutely. We think of Medicaid often as health insurance. Of course it is. But a Medicaid waiver is a different part of the Medicaid program. It covers long-term care. And that means I don't need a doctor or a pharmacist today and that's it. I need someone at my home, at my job, in my community, etc., on an ongoing basis. I need long-term help with various activities in my life. And that's what the Medicaid waiver is designed to do. So the waiver is a term used to say, Virginia has a contract with the federal government to offer Medicaid health care. This way, we got some of those requirements and restrictions waived to offer more services to people with developmental disabilities. We talk about waivers a lot because they're meant to be sort of a one-stop shop for people with developmental disabilities. You have high needs or low needs. You're living at home or you're an adult. You need supports for at least a year or you need supports forever. It's designed to be there. And it is really the only public, meaning free or low cost, way to get those ongoing services to help folks. So it's incredibly important for a big chunk of our community. There are two types of waivers that we're going to talk about today. The DD for developmental disability waivers and the CCC plus for Commonwealth coordinated care waivers. I talk about the three subtypes of DD waivers as a group. Their names are on the screen in the orange sections: community living, family and individual supports, and building independence waiver. All three of those together make up our DD waiver system. I mostly talk about them as a group, and that's because they have the same application, the same eligibility criteria, they share a waiting list, and a great majority of their services are shared, and they share the same case managers. It's a slight difference in some of the services that they offer that we'll get into later in the presentation, but that's why we're really thinking about those as a group, as one type of waiver with these little subsets or flavors. The other option, like I said, is the Commonwealth Coordinated Care Waiver. And as we go back and forth today, we'll compare how does the DD waiver system work versus this Commonwealth Coordinated Care System. And to start off, we're going to give ourselves some big mental filing cabinets for those things so we can dump our DD knowledge in one bucket and our CCC plus waiver knowledge in another. And this will help give us an idea right from the start about whether or not you want to explore one program, the other, or both. The DD waivers, as the name implies, are only for people with a developmental disability diagnosis. I often say autism, Down syndrome, cerebral palsy, Fragile X as examples, but the list is limitless because there are thousands of types of developmental disabilities, including some very rare ones. This waiver offers a lot of options, everything from little kiddos who need in-home care to people needing nurses, to people needing 24/7 awake services, to people needing residential care as they age or on-the-job supports. It has a big menu of service options, and it comes with a case manager, often called a support coordinator, whose job it is to help you say, what do you need? How can we match those needs to waiver services and services beyond the waiver? How do we create a plan for a good life? The downside of this program is that it has a significant waiting list, and we'll talk more about that as time goes on. But because that program has a waiting list, we often also talk about the CCC Plus or Commonwealth Coordinated Care Waiver. That program was designed to keep aging adults out of nursing homes. So to be eligible for that program, it's not just that the person has a developmental disability, it's that they have some sort of disability, Alzheimer's, dementia, autism, you name it, and significant medical needs. We'll dive into that in a second, but as you can imagine, not everyone with a developmental disability has the medical needs that would make them eligible for both programs. The CCC Plus waiver has a much shorter menu of services, some in-home caregiving options limited to a max of 56 hours a week, some limited nursing options, a couple of other things, and it doesn't come with a case manager to help sort of Sherpa you through things, but there's no waiting list. So that's why we talk about both of them. The more robust program has a waiting list, the less robust program has no waiting list. So it's good to know about both choices. For perspective, there are about 15,000 people in Virginia right now waiting for DD waivers. A quarter to a third of those also have enough medical needs to use the CCC Plus waiver while they're waiting on the DD waiver. So we'll talk back and forth about both. But if, as you're hearing this, you realize if you're the person with a disability or your loved one, really doesn't have any significant medical needs, when I talk about the CCC Plus waiver, feel free to take a little brain break for a second. Know that that may not be a good fit for you now, but as we age, we can develop, diabetes, cancers, motion issues, all kinds of other things. So it may be worth keeping in the back of your mind, just as a option for later if needed. So now we'll talk about how you know if you're eligible for one or both of these waivers. And that's done in three three prongs, I usually say, and then we look at three things. Someone's diagnosis, which is done through testing, usually a psychologist, they say, I think this person has Down syndrome. Their IQ is this. Their strengths and needs are this. Very similar for both waivers, that you're just looking for some kind of relatively recent testing on that. Beyond the diagnosis, the next thing the waivers look at are your functional needs. How much help does this person need to get through the day? Because there are certainly some people with developmental disabilities who have very, very few support needs. And even though they have a developmental disability, if they don't have a lot of support needs throughout the day, they're likely to be told they're not eligible for a waiver. They don't have enough care needs to enter this program. So when you do those functional assessments, it is very important to have someone who knows the person well or the person advocating for themselves who can speak about the really significant needs that they have throughout your average day, week, month, year, etc. There's different tests that are used to assess that eligibility. For the DD waiver, it's a test called the VIDES. It's on the Arc of Northern Virginia's website, and I'm a big believer that if someone gives you the test ahead of time, look at the test. So if you go to the arcofnova.org and click resources, resource library, that will bring up an alphabetical menu. If you go to the waivers section, you'll see the VIDES there, and you can have a look at it. It's got the scoring guide. It's got everything. The CCC Plus waiver uses an assessment called the UAI. It's also publicly available, and it's another good thing to look at to prepare, just so you know the kinds of questions that they'll ask about. And so once someone shows that they've got the relevant diagnosis for a waiver, they have some significant support needs, the last thing that we look at for waiver eligibility is financial eligibility. How much money does this person have saved, and how much money do they have coming in each month? And here the waivers are very similar. So let's dive into these three things a little bit more. Starting with IQ, this is the very long definition, just so you have it, that Virginia uses to define a developmental disability. But what they're really looking at is it onset in childhood and it's going to continue. It's impacting the person's life in a number of significant ways, and there's an IQ score on that assessment. There's not an IQ minimum or maximum, and different IQ scores don't entitle the person to different types of services or care, but they look to see that that IQ score is there. Lots of people use diagnoses and IQ scores that came from just the regular private psychologist through their insurance program. If you got a diagnosis through a school psychologist, that could be used. Those sorts of things is what they're looking for. And for the CCC Plus waiver that requires a type of disability, you're looking for something similar. Same kind of diagnosis paperwork along with some medical paperwork. And my goodness, if we have a medical diagnosis, don't we know we've got lots and lots of paperwork backing that up and showing those kinds of needs. If you're not sure if the medical needs that you or your loved one have might be enough to rise to the eligibility standard for this waiver, at the bottom of this slide, and again, attendees will get these, there's a link to an unofficial self-assessment that I think is great. It's put out by a group called Moms in Motion, and it'll walk you through the kinds of things that this waiver is looking for. That would be things like hands-on help with bathing, dressing, using the restroom, in addition to medical care. Is that a specialized diet that's overseen, nutrition, range of motion exercises, seizure protocols, suctioning or G-tube work, all those kinds of things. It'll walk you through it. So moving on, like we said, waivers, three things. Diagnosis, we talked about the paperwork you'll need. Then functional needs. Like I said, the DD waivers use that test called the VIDES. There's a version for little kiddos before they're 3, for kids 3 to day before they turn 18, and for adults. It's meant to compare same-aged peers, and it's looking to see at any given age, is the person with a disability needing notably more supports than similar aged peers. Again, do yourself a favor and look at it at the Arc of Northern Virginia's resource library page, just so you're prepared for what they'll ask. The person with a disability will be in the room when they ask these questions, and they have to be a part of this interview. With that said, if there's a particular section of this, I'll use behavior as an example, or medical or self-care, that you know is going to be very upsetting or embarrassing for this person when you, maybe as the parent or caregiver, have to really talk frankly about the needs that this person has for using the restroom or diapering care or the needs that the person has for managing challenging behaviors. None of us like to talk about our worst days in front of strangers, right? You can absolutely talk to the assessor ahead of time and say, we would like for my loved one to be able to sit out in the hall and have some reading time, iPad time, sit with someone else while we go through this particular section. It's going to be really triggering for them. And that's okay. For the CCC Plus waiver, like I mentioned, the Uniform Assessment Instrument, the UAI, is the tool that's used. Unlike the VIDES, which has the scoring guide on the front, if you answered these numbers in these categories, you are eligible kind of thing. The UAI doesn't do that. The results of the questions are interpreted by a nurse to determine eligibility, but still definitely worth looking at that assessment ahead of time because it'll give you a sense of what they're asking. I can't say enough. Bathing, dressing, restroom, hands-on care kind of things, and medical care needs. But nice to know those questions ahead of time. I want to be clear that in all these cases, a professional assessor will give this assessment and will record answers, but you are welcome to have your own copy of that assessment where you have reviewed things, made notes for yourself, otherwise prepared, so that you make sure as we're busy and our brains are busy in that room in this kind of high stakes environment that we don't forget things that we thought about ahead of time. So now financial eligibilities. We need diagnosis for both waivers. We need to show those hands-on support needs or other support needs and financial eligibility. Now, waiver rules for financial eligibility are more flexible than regular Medicaid rules, which is a great thing. For regular Medicaid, we're usually looking at income and assets for the whole family if the person's a child, and income and asset limits are really tight. But for children applying for the waiver, we don't look at the parent's income or assets at all. We're really only looking at the child's monthly income. And for most children, that's nothing. So that makes it a lot easier. For adults with the Medicaid waiver, we do look at their assets. That would be money saved in a checking account or a savings account if they've got stocks in their name, those kinds of things. And we do look at their income, but those limits are still more flexible than they are with regular Medicaid waiver, or excuse me, Medicaid non-waiver eligibility. So for hard dollars in 2025, adults and children with the Medicaid waiver, they themselves can have up to $2,901 a month. That number adjusts with inflation every year, which is why it's sort of a quirky number, and still be eligible for the waiver. There are some limited circumstances where they could be earning slightly more than that and be eligible for the waiver. If you think you might be in that boat, feel free to put a question in the chat or send me an email. I'm the person who's sending out the reminders for this. Go to the arcofnova.org/answers and send me a question there, and we can talk through that. I will note that $2,000 in assets for adults is not a lot of assets. That number hasn't been adjusted in many decades. So a lot of families choose to put someone's assets like savings, life insurance policy, inheritance left by grandparents, money that the person earned from work, the Social Security payback, you name it, all kinds of cash or other kinds of assets that we have into a special needs trust fund. A special needs trust fund is different from a regular bank account in that the money is only allowed to be spent on the person with a disability. There's a lot of protections around how that money can be used to protect the person with a disability from abuse, right? This isn't meant to buy family and girlfriends lavish presents. This is meant to offer services directly to the person with a disability. And it's not counted as an asset by the Medicaid health insurance program, by Medicaid waiver, housing vouchers, Social Security, all kinds of public benefits. They'll look to see that the money's there, but so long as they see it's in a special needs trust, they don't count it. And so if you're ever wanting to make sure that your loved one with a disability can save or inherit money, great idea to set up a special needs trust to make sure there's a safe place for that money to sit that doesn't cause them to be ineligible for other services. The arcofnovatrust.org is the website for our special needs trust if you want to get a sense for them. So now let's talk about services. We know there are these two waivers, DD and CCC Plus waiver. We know that if you're trying to figure out if you're eligible, you'll need to look at your diagnosis, your day-to-day needs, and the money you have coming in each month and the money in the bank. What do these waivers get you? Well, that'll depend a little bit based upon the needs of the person with a disability, but we can take some broad looks at it. All three of our DD Medicaid waivers offer some kind of residential services. The community living waiver that you'll see on the far left offers the most. This waiver is the type of DD waiver set aside for mostly adults with developmental disabilities who have 24/7 needs, meaning we're going to need someone awake overnight, very often working and checking with them overnight. There's really not any significant amount of time this person is going to be alone throughout any given day or week. So a big range of residential options, and this is the biggest difference between the three types of DD waivers. Remember, I said we kind of think of them as a unit. This is really where you see the space between the two of them. The second type of DD waiver, the FIS for family and individual support waiver, does offer a couple of residential options to make it possible for adults with developmental disabilities to live away from the family home if and when they're ready. The building independence waiver is the smallest used of these DD waiver subsets or options. It's really meant for adults ready to live away from family who have relatively few support needs. Think like 3-ish hours a day or less. Maybe someone who would come by each week and do the big grocery shop, meal planning, pay the bills, but these folks could be alone a significant portion of the time, maybe with remote monitoring, maybe with push buttons so that they could call 911 quickly, those kinds of things. But folks who have pretty few care needs. The CCC Plus waiver, by comparison, has no out-of-parent home or out-of-individual home residential options. Okay, so as we get a sense, this is the difference that most people think about. Now, if you're talking about a waiver for someone who's a child, this may be fairly irrelevant at this point, right? Kids generally stay home living with their parents. But as you think about the future, that's when this will come into play. For employment and day options, as you can see, all three of our developmental disability waivers, once again, are pretty much the same. They generally offer the full range of day and employment options. If someone wanted to do unpaid work where they were learning life skills, doing crafts and activities, the waiver can fund that. If they wanted to work part-time, if they wanted to volunteer, if they needed small group sessions to learn new skills, all of those kinds of things can be covered by the DD waiver. Again, for comparison, the CCC Plus waiver doesn't offer any employment and daytime specialized services, which is why a lot of folks waiting for a DD waiver use this, but it's great to have a DD waiver in the long term. It just gives a lot more choices. Now we'll talk about services, when I say in your own home, which could look like an adult or child with a developmental disability living with friends or family. It could look like an adult with a disability who's in their own apartment and is having supports drop in or live with them, those kinds of things. The three DD waivers offer a few different things here. The two that are most often used are community living and family and individual supports waiver can fund someone who can come on a regular basis and work on skill building. I would liken this most to IEP goals. In the next 6 months, we're going to learn to I'm so boring. Make a sandwich, whatever it is. Make our lunch each day. We're going to chart our goals. We're going to chart our progress. We're going to look toward it. It can offer just a one-on-one personal assistance caregiver who, if you need help, bathing, dressing, using the restroom kinds of things, they help you. If you need help going out and buying a movie ticket and setting up a date with a friend and going there together, they could help you. If you need help making the bed and paying the bills, they could help you, right? It's your flexible kind of one-on-one aide who's there for you. You can offer a companion if you need someone who's there sometime, mostly for eyes and ears and safety, even if they're not doing a lot of hands-on care. Those waivers come with respite care. So everything else through the waiver, again, kind of thinking back about an IEP or school education plans, comes on a set schedule. This is how often we do these things. But of course, we know there are times when there are school breaks, when there's bad weather and someone's not going to go to work, when there's all kinds of other life changes and we need more hours of care in our home than we usually do. Those waivers come with a pool of 480 hours a year of respite care for exactly that. So lots of families use those hours for things like school breaks or unusual days. Maybe parents or regular caregivers are out of town and we need to bring someone else in. All of the waivers, DD and CCC Plus, can offer changes to the person's home or car to make them safer, more independent. So that absolutely is things like van lifts and wider doorways and ramps. It can be things like fences or keypad locks to keep someone safe in their own home if they have a tendency to run away. All of the DD waivers and the CCC Plus waiver offer that remote monitoring service that I'd mentioned briefly earlier. So that would be if someone was going to be at home alone for like more than an hour each day on some kind of regular basis. It can be a push button system that means instead of that person saying, something's wrong, I know I should call 911. I should tell them my name and where I live and everything I'm thinking. If they push the button, 911 is called for them, and emergency services are called for them. And it'll bring up a profile that says this person with this disability, these needs, lives at this place. If the button is pushed, head on out to them. And it can go a long way toward helping folks live more independently. The CCC Plus waiver here, kind of by comparison, does offer that one-on-one caregiver and some respite. Like we talked about, it can offer some changes to the home and that emergency monitoring system. So here we see how that CCC Plus waiver can help people stay safe and stable in their own home or their family's home, even though it's less comprehensive than our DD waiver choices. In terms of nursing and other kind of similar options, really the full cadre of choices is there if that's what the person needs. And this, I would say, is frequent if someone has a G-tube, a trach, suctioning needs, IV medications, those sorts of things you would think about for waiver nursing and need a nurse to either oversee care or to provide that direct care. The person has so many nursing needs, we need a nurse to be there with them all the time. Those are an option for anyone other than our folks with the building independence waiver, who I mentioned are folks living away from home who have relatively few support needs. We wouldn't expect them to need a lot of nursing care. Some other services that I think are worth knowing about, all three of the DD waivers offer a great service called electronic home-based services. That can be things that are one-time installs like stoves that shut themselves off, doors that automatically lock themselves, or it can be more like remote monitoring things, a sensor to see whether or not someone got and stood in that shower for how many minutes each day our shower's happening, a button for if someone with a disability is feeling anxious or lonely, they can push and be connected with someone right away who can say, hey, I'm here with you. Let's talk through this, those kinds of things. Maybe we don't need staff there all the time, but we need someone on call quickly. That's the sort of options that makes available. All of our DD waivers offer assistive tech. Often I see this being phones or tablets with apps to help the person maintain independence or grow skills, but it can be other things. The CCC Plus waiver does offer that too. All of our DD waivers offer some kind of crisis support and a community guide to help the person grow their relationship and skills in the community. Okay. So that was our quick breeze through of DD waiver services and CCC Plus waiver services. I want to again remind you, I wouldn't expect anyone to memorize that list. And if I can keep harkening back to an IEP, or a 504 plan, which a lot of us know about, when someone with a disability is actually given a waiver, you're going to sit down with a team who's going to create a plan. What services do we need? How much? What do they look like? Who provides them? So it's not like you need to know all that going in. You'll be walked through step by step and you can change it whenever you need because either something's not working or because needs change. That's fine. So now let's talk about how we would apply and navigating that waiting list I've alluded to a number of times. For the developmental disability waivers, for any of the three of them, you're going to apply by calling your local community services board, often called the CSB. That's a county government or city government agency. You're going to give them a phone call, and the numbers for the Northern Virginia CSBs are on the screen. You're going to ask them for a paper application. They'll mail it to you. You'll return it with the application itself filled out. There are not weird, tricky questions on it. It's things that you, as the person with a disability or your family, will know, and a copy of that diagnosis that we talked about way in the beginning. They're going to look at it and say, looks like this person met diagnostic eligibility for the waiver. Let's sit down and do the functional needs test. Do they have enough daily support needs to be eligible? And they'll do that VIDES that we talked about earlier, where you talk through questions about what the person needs. If they agree that the person is eligible, they'll put them on a waiting list for this program. I mentioned we have about 15,000 people right now in Virginia waiting for this program. And the waiting list is broken down into three groups. Priority 1, people who are most urgently in need of services. Think we've got parents who have their own physical or mental health needs going on, or aging parents, or we've got someone who's on the cusp of or has graduated from school and doesn't have a good place to go during the daytime. We've got someone who's experiencing homelessness. We've got someone with challenging behaviors or physical needs or medical needs that we're not able to otherwise meet. We get the sense that these folks are urgent, right? In 2024, the governor of Virginia put forth a plan that was funded by our General Assembly to make sure anyone in this category got funding by the time we reach 2026. We're racing forward and we'll see how that works out, but lots and lots of people in this priority 1 category are getting services now. Waiting time is unpredictable since it's based on urgency of need, but as you're hearing these kind of priority things, if you think, ooh, maybe we are priority 1 people, make sure you emphasize those kinds of needs, be it about the family, the needs of the person with a disability. Priority 2 are folks who are relatively stable, but they could certainly do with some help. Maybe there's some needs we're having trouble managing. It's a behavior need. We've got some help through private insurance, but it's hit and miss, those kinds of things. And we've got priority 3 folks who are generally young, happy, healthy, stable, maybe have multiple parents or adults in their life who are involved, maybe have private insurance or private pay options. Absolutely, a waiver would help, but they're doing okay otherwise. So these people can move up or down on the list at any time, depending upon the urgency of their situation changes. When our state government funds new Medicaid waivers, like I just mentioned that they did, the local community services board where you applied essentially does matchmaking. They work with a volunteer committee who looks at, here's who's at the top of the waiting list most urgently in need. Here are the waivers we got. Let's make some offers and see what people need and do the best we can to pair them up. The CCC Plus waiver, by comparison, is a little bit different. You start off by calling the Department of Social Services, sometimes called something different like Department of Family Services in Fairfax, and you do a phone screening first, whereas the DD waiver starts off with that packet of paper. The phone screening will touch on the same kinds of things we've harped on today, hands-on care needs and medical needs. If they feel like that phone screening indicates the person's likely eligible, they'll send out a nurse who'll ask very similar questions about hands-on care and medical needs in person. If the nurse agrees that the person is eligible, they'll say, congratulations, you're getting a waiver. We're going to start the process of getting your Medicaid in place and getting services in place. It's not instant, even though there's no waiting list, because as you can imagine, this is filling out paperwork, choosing providers, getting services authorized, all that kind of thing. But I would say usually a couple of months from the start of the application till someone really truly is receiving services. My contact information is here on the screen. I am faster through email than anything else, but you can also always go to the arcofnova.org/answers to ask me some questions. I'm going to turn off sharing my slides just so I can see things a little bit better in the chat, but if I need to pull them back up as we have questions, that's no problem. So feel free to start typing those questions in anytime, anything you wondered about as we were talking. So one of the first ones is about something that's not really a waiver service, but is about a Medicaid option, meaning Medicaid health insurance. And that's called the HIP program. HIP, H-I-P-P, is an acronym for Health Insurance Premium Plan. HIP is a program, you can imagine, if you have Medicaid, Medicaid pays for a lot of caregiving, medical care, hospitals, prescriptions, etc. for you. So it's to Medicaid's benefit if those folks with Medicaid also have an employer-sponsored plan who would help share those costs, right? That's a cost savings for Medicaid. So HIP is a program that says, if you've got a good employer-sponsored plan and Medicaid, we can consider paying the monthly premium for you to stay enrolled in that monthly employer plan. And when I say employer plan, I can mean through parent's employer or the person with the disability's own employer, if they're an adult and working. So it's an incentive for you to keep the employer-sponsored plan because it gives you money toward paying the monthly enrollment copay toward that. It's an incentive for Medicaid because it means they don't have to cover the full cost of all insurance care kinds of things. So hopefully that makes some kind of sense. It usually is a win-win and doesn't involve a ton of paperwork. I will say HIP for kids under 19 is the rules are a little more flexible than it is for adults who are 19 plus. With that said, HIP is only available if you've got the kind of employer-sponsored plan they want. They won't do like high deductible plans or self-employed plans, but they'll do a lot. And Medicaid. So this question came in from someone who's on the waiting list for a Medicaid waiver. And they're saying, would we be eligible for HIP? And now we know the answer is no, because you don't have Medicaid. There's no cost savings for Medicaid for them to keep you enrolled in your employer-sponsored plan. But if at any time or whenever your child does get Medicaid because they come off that waiver waiting list, HIP is definitely worth considering. There's not a ton of information out in the world about HIP, but if you go to the ARC of Northern Virginia's YouTube channel and type in HIP, again, HIPP, there's a 3-minute video we have that'll walk you through the basics and give you contact information with the state. If this sounds like something you want to explore an hour later, just know it's like every 3 months, I believe, your office's HR department fills out a form that says, yep, this person continues to be enrolled in the employer-sponsored plan. Here is the portion of that monthly enrollment that belongs to the person with a disability. Medicaid's not going to pay to keep your whole family enrolled, but they will pay to keep the Medicaid member enrolled. And so if you have multiple kids, they'll calculate the share for your child, that kind of thing. And then Medicaid receives it and then sends a check back to the family saying, great, we'll pay you to keep paying this premium each month so that there's another insurance in play. And it's a great option. I don't see any other questions coming in. Please feel free to ask anything, even if it's sort of waiver adjacent, like that question, not directly weighted to the waiver or other disability services. We're happy to answer those sorts of questions now or anytime in the future. Can you keep your spot on the waiting list regardless of how many people apply? That's a great question, and I should have talked through this a little bit more. Once you're on the waiting list, as long as you stay eligible, you stay on the waiting list. What do I mean by stay eligible? I mean, you continue to live in Virginia. You can move around in Virginia from one area to another. That's fine. But all waiver programs are state specific. So if you moved out of Virginia, this wouldn't matter anymore. You continue to stay in Virginia. And at least once a year, the waiver program is supposed to reach out to folks with a little message saying, do you want to stay on this waiting list? And do you have any new needs we should know about? So the obvious answer is, yes, I want to stay on this waiting list. In terms of new needs, that would be things like the crisis sort of services we talked about or crisis needs that we talked about that would make someone higher up on the waiting list. Anytime you can call the Community Services Board or email them, whatever suits you, and say, hey, my loved one, XYZ person, is on the waiting list. I wanted you all to know that this year, mom got a diabetes diagnosis, and we're really struggling to help take care of their caregiving because she used to do a lot of their care and now she's really sick. Or we got another child who has a significant disability. We're struggling to take care of all of the needs. Or a parent lost their job and we lost the private insurance that paid for behavior supports. I'm trying to give concrete examples, though they're sort of grisly, so that you can really get a sense of the kinds of things that you would want to tell them. Absolutely make sure you're responsive about that. We're humans. If for some reason that annual letter or notice comes and you don't remember to return it and fill it out, they'll give you another letter that says, it looks like you want us to remove you from the waiting list. We're not hearing from you. Then you can go back to them. The absolute worst case scenario is you would miss that too. And then you would go back to the Community Services Board and say, looks like we're going to have to do those meetings again. I'll give you a new copy of the diagnosis and we'll sit down and do the VIDES again to get back on the waiting list. So you can wait as long as it takes to get to the top. I really hate giving averages of how long someone would be on the waiting list because I've been at the ARC of Northern Virginia since 2008. And I can tell you there are years when no waivers go out and there are years when thousands of waivers go out. And that's sort of at the whim of state funding. So I wouldn't count any averages, especially given that it's based upon urgency of need in terms of a guess. I will say most people wait more than 1 year and probably most people wait more than 5 years. But if you're not applying until you're in a crisis, which I don't suggest, please apply early so that when you're in a crisis, you can just call and say, bump me to the top of the list, give me help. Then your service time, your wait time is going to be much easier. Okay. I've got another question about HIP. Oh, yeah. So exactly. So you referenced someone in another state using this program. And exactly like I said, Medicaid rules and eligibility, especially for waiver, vary widely state by state. So I would never dissuade someone from talking to friends or family or advocates in other states. Just take anything with a grain of salt, since it can be different, pretty significantly different. So if I'm number 4 in January and 50 people apply more urgently, would I still be number 4? I wouldn't say it works exactly like this. Anyone who's on the priority 1 waiting list gets a numeric score based upon how urgent they are. So it would be things, I'm making these numbers up off the top of my head because I can't remember the exact ones, but to give you a sense of it. The person is homeless or about to become homeless, 10 points. One or both caregivers is incapacitated, 5 points. The person's about to age out of school and doesn't have any place to go, 4 points. So the more of these kinds of questions you answer yes to, the more points the person has. That doesn't change. Their score doesn't change unless their situation changes. If you look at the whole waiting list, the portion of people who are in priority 1 in urgent need is shrinking really fast because of this governor's plan to fund everyone on that part of the waiting list. So my expectation is within about the next year, almost everyone who's currently in priority 1 will be offered a waiver of some sort. If that doesn't happen to you when you're in priority 1, then you're going to be one of very few people. And then after next year, you would theoretically be at the top of that list. It's not 15,000 new people each year applying for this program. So I don't want to give a false sense that there's an incredible competition between families for these services. Your job is just to make sure you know you need a waiver. You're regularly in contact with the CSB so they understand those needs. And I'll harken back to the arcofnova.org resources, resource library, waiver section. There's also a 2-page document we have about advocating for yourself while you're on the waiting list. It'll walk through some of the kinds of things that you would want to make sure the Community Services Board knows and how to best make sure that you are selling your case to get a waiver as soon as possible. All right, we've got a kiddo here, autistic, 6, non-speaking, who elopes, super scary behavior, right? Would qualify for CCC Plus or DD waiver. He's currently on my employer plan and I'm looking for respite because I'm exhausted. Oh my golly, of course you are. Who wouldn't be? So absolutely. I feel like it's gross for me to say, you're exhausted? How about you apply for these programs? But I know you're exhausted. How about you apply for these programs? If you can qualify for CCC Plus waiver, it means within a fairly short period of time, you can get an attendant there. You could get things like I talked about, like keypad locks on the doors that we've seen so that someone can't open the door and run out without entering the key code from the inside. That might be a tremendous help. Even people on the waiting list for the DD waiver get a chance once a year to apply for what's called IFSP. I think of it as like flexible grant funding. And families can use that even if you didn't have a waiver yet, to put one of those kinds of keypad locks or other sorts of complicated locks on the door. We've got lots of families that put chimes on the door so that they know when the person is running away. We've got lots of families who use GPS devices or tools like Project Lifesaver. It's a great program where the person with a disability is wearing what's essentially a radio tracking device. And it can be a bracelet or a necklace or tied to their backpack or their shoe or whatever they're regularly wearing, their wrist, you name it. That allows police and other first responders to locate them like almost immediately. The program is for folks with Alzheimer's, dementia, developmental disabilities, you name it. And as you can imagine, the need's big and the recovery rate in that program is something like 99.9%. Quickly, they're able to get to folks really fast. I would also advise every household, especially those who have a loved one with a disability, internet search the name of your county, Arlington, Fairfax, Alexandria, Loudoun, whatever, and then Community Connect. A lot of our local jurisdictions enable you to enter profiles with those groups. And when you call 911 or 988 for a crisis, the profile comes up to that 911 operator that says, non-speaking 6-year-old with autism lives in this house, known to elope. Past places they've eloped to are these places. This is how you best communicate with them. Mom is the emergency contact. This is her cell phone number. I mean, there's no limit to how much you can type in there, so that if your neighbor, anyone else calls in an emergency, you have already front loaded all of that information there. And now we see police, fire, rescue, everyone has those giant laptops in the front of their vehicle. That information all populates to the front of that laptop screen when they're returning a call related to that address, name, phone number, etc. So not only does the 911 operator know it, it can help them send out a crisis response team who is good at working with people with disabilities. And it means every officer who shows up can see that information too. So it's one way, even outside of the waiver system, to do as much as you can to make sure we've got the right people with the right knowledge responding in the right way, which can, of course, make a life-saving difference. I wish I had better magical answers than that, but there are choices and options out there. I don't see any other questions. I'll give people one more minute as we wrap up. Again, this video will be at the Arc of Nova's YouTube channel. If you registered today, you'll get a link to it and a PDF version of the slides that I shared emailed to you. If you're looking at this later, the arcofnova.org/answers is a great place to ask those questions or any other sort of disability questions you have, and we'll always do our best. Oh, this is another great question. God, I'm pulling us back in for one more. It'll be worth it. Is the health insurance part of Medicaid? Like I talked about, they're kind of different things. The waiver is the caregiving. The Medicaid is the healthcare. Different from waiver services. Is it administered differently? Yes. Financial eligibility is different. So if the person with the disability, their household, we're told they're not financially eligible, their income isn't low enough to be eligible for regular Medicaid health insurance, they're still eligible for Medicaid waiver. So don't ever let family income and assets, all those kinds of things, stop you from applying for the Medicaid waiver. That part can still work. Absolutely. Don't worry about that. Like I talked about, the monthly income limit for waivers is $2,901 for the waiver user. No limit on whole family or household income. The waiver user's monthly income is $2,901 at a max. Asterisk. There are a couple of exceptions to that. And if you're in that boat, email me, but it's probably too in the weedsy to go through with everyone here. If you have a Medicaid waiver, you get Medicaid to use as the health insurance bonus, because that's a really nice thing to have. It can help with copays, prescriptions, hospital visits, you name it, medical equipment, all kinds of things. And that's usually run through managed care companies. Your Medicaid waiver services, the DD Medicaid waiver services, I should say, are not. They're run through the Community Services Board, like we talked about. So you'll be working with two different groups. Some folks with a waiver really heavily use the insurance side of Medicaid for therapies, prescriptions, copays. Great for you. You'll work through your managed care company to do that. Some people barely use that Medicaid at all. They don't have a lot of healthcare needs. They really like their private plan. Their doctors don't take the Medicaid. Fine. The Medicaid still is there if you ever need it. Pretty much all hospitals and ambulances take it. It's so nice to take that copay to zero if you've got Medicaid waiver services too. Okay, now for you. I think we're ending, and it was lovely to be able to spend part of the morning with you all. I look forward to you reaching out to the Arc of Northern Virginia anytime with any questions you have. Again, my name is Lucy. You can ask for me directly, but frankly, most general questions that come in come to me anyway. So you'll probably get you regardless. I look forward to being in touch and seeing you at future events. Thanks so much. Bye-bye.